Joining us now is Eric Wallis, the president of Henry Ford Hospital, West Bloomfield. Thank you for joining us again, Eric. Good to be with you today.
No, actually, Dave, I really appreciate you having me, and I appreciate the reminders to everybody that this thing has not quite gone away yet, but and we need to remain vigilant.
I'm sure that your people, the physicians, the nurses, and everybody else at the hospital, they've been on the front line. They've seen this firsthand, so they probably don't need reminders. But you guys have to, stay at it too, because the disease is still out there. I'm sure that's going through everybody's minds at the hospital. Can you talk about that?
Yeah, no, I think we feel very blessed that we've kind of gotten through this whole event to this point. I'm excited to say that even today here in our hospital, we're in the number of single digits of patients that are in the building that are COVID positive, which is a tremendous, I guess, testament to the hard work that everybody's done. The fact that people have been doing social distancing and wearing their masks. But we are very concerned about the potential of, as the state reopens, that another wave of this happens. I think just last evening in the news, they talked about, 9 states across the country where they're seeing their highest numbers ever of COVID now as they've reopened. So we're trying to stay prepared, making sure that we get as close back to normal as we can, but at the same time, again, acknowledging that this hasn't gone away yet, that we've got to be prepared for what's going to come next.
Eric, the deep concerns at the very beginning of this were, A, we didn't really know what we had on our hands. B, we were very concerned that medical practitioners and hospitals would be able to even accommodate the numbers that would be coming at them. Now we know a little bit more about how to treat the disease. People know how to do some prevention of their own. And capacity, at least today, and supplies and testing and PPE, we seem to be in much better shape. So we don't want to see it, but if there is a peak or we see numbers start to creep up here in Michigan, aren't we better able to handle that now than we were in March?
Yeah, no, we are certainly in a better place today. I think, we are blessed here in West Bloomfield to be part of the Henry Ford Health System. And we've seen some of the things that our system has done to prepare for that. And if it comes back in the future, we are now sitting with, significant supplies being prepared. We're trying very hard to have at least a 90-day supply of everything that we would need to treat these patients. You've seen recently, I think, some of the announcements that our health system is entering into agreements with other folks to be able to actually produce personal protective equipment here in the United States. So we're not reliant on a supply chain of things that comes from China or other places around the world. And so I think, we will be much better equipped. As always, the number of beds that we have is the number of beds that we have. And so when we exceed that, it gets a little more challenging. But I think we're going to be in a better place to make sure that we have the supplies and the drugs and things that we need should that second wave come.
Yeah, and hopefully at the point that we get a vaccine, which we hope will happen sooner than later, but could be a while off, that we're able to get enough of that vaccine and get it distributed equally and fairly around the country and manufacture that. But, I feel a lot better because I think at least now anything that is essential and related to COVID-19 is going to get made in the United States. I think we've learned that lesson because it can easily be said that, I don't want to get political, but it could easily be said that that they didn't help us in China with the disease, and then they didn't help us either with all the things that we've been counting on them to export here to the United States in a timely way.
Yeah, no, as I said, again, I feel very blessed that our health system's got some amazing people in supply and distribution. And we got shipments of stuff from all around the world and planes flying in from the Middle East and from China and from other places. So we maintained having enough PPE throughout the entire event, but there definitely were some nervous days as we went along.
Eric Wallis, President Henry Ford West Bloomfield Hospital. So we understand from reading the news accounts that people can now visit people in the hospital. How's that working? Can you talk us through that?
No, absolutely. And I said it's one more step toward a little bit of normalcy. And I think, the last couple of weeks, the governor has removed the restriction that we can't have any visitation. And so what she did was really require of each of our hospitals that we have policies in place that do still restrict visitation. but allow folks to come. So here at our hospital, we have open visitation from 9 a.m. to 9 p.m. All of our patients are allowed to have one visitor at a time. So, if folks have multiple family members that want to come visit, they can kind of trade in and out. Folks should expect that when they come to the hospital, they're going to be screened. So we're going to take their temperature. We're going to ask them if they've had any symptoms in the last 3 days, just to make sure that they're not sick and coming as they come into the organization. We've opened up a lot of our what I would call non-time sensitive testing and office visits for our physicians, et cetera. And so we're allowing folks to come and do those. We are still asking folks not to bring visitors if they're just coming for an x-ray or coming for an office visit. But we've got folks that need help getting around, and they need someone to help translate for them. So we do have exceptions that are in place to allow people to have those support folks here with them as well. So like most things, I'd love for it to be completely black and white. We have, I would call them more guidelines and guardrails than they are, kind of black and white, here's how it's going to work. Our goal is to keep everybody safe. At the same time, we know how important it is that people have their family and their loved ones around them when they're trying to recover from an illness.
Eric Wallis is the president of Henry Ford Hospital, West Bloomfield. Eric, I didn't brief you on this, so if you don't know anything about it, it's okay. And you say, "Uh-oh, what's Dave going to ask me now?" Very simple. So my friends at Fantasy Lighting just texted me a note just a minute ago, and they said, "You're nodding, good, you know about it." They said they came by late one night a couple of days ago and lit up your hospital. Can you tell us what happened? I missed that. I feel bad. I would have been there had I known the exact date.
No, that's all good. We, earlier this year, we had a hospital week at the beginning of May, and that really wasn't a good time to try to have kind of a celebration. We were kind of deep into the thick of things. And so last week, we pulled some things out of the freezer and had a little cookout to celebrate our team members. And that night, we had around midnight, had a little celebration for our night shift team as well. And the folks at Fantasy Lighting were amazing. They came out and projected some words of encouragement up on the side of the building, and we had a little steak grill out on our patio, so everybody could be outside and be socially distant. But just the smiles and the looks on everybody's faces when we had something that was a celebration of our team was a lot of fun to do. We hung out here till 1 o'clock in the morning and fed a whole lot of people. And like I said, the folks at Fantasy Lighting, people walked outside, they saw that display on the side of the building, and just, a lot of them just smiled, laughed, and were so grateful to be thanked by the community that way.
Well, just one small expression of thanks. Do the people in your hospital and that are working there every day, do they know how much that they're appreciated by the community? I mean, the outpouring's been amazing, but I know they're all working so hard. Maybe they don't see it all.
I think one of the things I love about this community is people have gone above and beyond to support us, to thank us. We've had, I think the last time I counted, something like 800 donations of either food or stuff or PPE or things that came to this hospital from community members to support our team. And so, I think you're absolutely right. We got a lot of folks who've had their nose down to the grindstone and just trying to make sure that we get through each and every day. But the expressions of gratitude, we've had people that have placed signs in our team member parking lot as folks have come in and people come onto the campus. We just had folks that show up at the front door some days saying, "Hey, I want to donate, XYZ to your folks or feed one of your departments." And so that has been extremely overwhelming, and we are forever grateful for the support of this community.
Eric, I know the answer, but I just want to take an opportunity to reinforce this with people. If you need some elective surgery or some other elective procedure, or there's any reason why you need to go to either your hospital or any hospital right now, there's no reason why you should be fearful of capturing the COVID-19 virus yourself.
No, you're absolutely right, and we want to continue to stress to folks that we're here. We've got a lot of things figured out with this. We know absolutely how to keep people safe. You're going to come into the building now and you're going to see things will look a little different than if you've been here in the past, because we're going to keep people distant. We've got, hand sanitizer and cleaning schedules and all kinds of things to keep folks safe. I would tell you that, hopefully this gives folks a little comfort. A lot of our non-time sensitive or elective surgeries are already rocking and rolling. So we're seeing a lot of folks come back. We're having a lot of great outcomes for folks. We still are hearing a lot of folks that have a little bit of concern too. So we've got. I would say to folks, we've got this. We know how to keep everybody safe, and if you need care, we're here, and we can do it for you, and have it not only be safe for you, but have it be a great experience too.
Eric Wallis, thank you very much for joining us. Good to have you with us. Glad things are going well at Henry Ford Hospital, West Bloomfield, and we wish you the best of luck with everything. And let's keep in touch.
All right, thanks, Dave.
All right, he is our one of our top executives from our area hospitals here. We appreciate him coming on the show with us on a regular basis, the president of Henry Ford Hospital, West Bloomfield.